and then swing your legs back around this way, off to that side. Now I'm going to inspect your posterior chest. I'm going to feel for any lumps. I'm going to feel your spinous process. I'm going to check for tactile fremitus. So when I place my hand, you say 99.
Okay, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Good job. Okay, and I'm also going to check thoracic expansion. So I'll pinch a little part of your skin here. You take a deep breath in and out for me. Good job. And that was symmetric. Now I'm going to percuss, okay? So I'm just going to be tapping on your back here. And that was good. And then I'm going to listen, okay? So each time I move my stethoscope, you just take a deep breath in and out for me, okay? Do it again. One more. Again. Good job. Now I'm going to check for egophony. So each time I move my stethoscope, you say E.
E, 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 E.
Good. Now I'm going to check for bronchophony. So each time I move my stethoscope, you say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Good job. Now we're going to come back around to the front. Now I'm going to inspect your anterior chest. So this is the front of your chest here. I'm just feeling for any lumps. I don't see any. And then I'm also going to percuss. I'm going to do the same thing. I'm just going to tap on you here, okay? And make sure a placement can be seen on this. And that was good. And I'm also going to listen to your heart and lungs, okay? Doing okay?
Mm-hmm.
Good. Okay, so just punch forward just a little bit for me. Listen to your heart. Good, and then just breathe normal for me. That was good. Okay, now I'm going to lie down. Get up around the pillow. Okay, first I'm just going to inspect your precordium, and then I'm going to feel for any pulsations or thrills. I don't feel any. I'm going to feel for your apical pulse, and that is the fifth intercostal space mid-clavicular line. Then I'm going to listen to your apical pulse. Sorry. good. Rhythm was regular and rate was 90. Now I'm going to listen to your heart sounds, okay?
Mm-hmm.
I'm going to do that with both the bell and the diaphragm and the bell of my stethoscope. So we're going to start here, aortic, which is second intercostal space, mid-clavicular line. Pulmonic, second intercostal space, mid-clavicular line. Herb's point, third intercostal space, left sternal border. Tricuspid, fourth intercostal space, left sternal border. And mitral, fifth intercostal space, mid-clavicular line. And then we do the same thing with the bell. Aortic, second intercostal space, right sternal border. Pulmonic, second intercostal space, left sternal border. Herb's point, third intercostal space, left sternal border. Tricuspid, fourth intercostal space, left sternal border. And mitral, fifth intercostal space, mid-clavicular line. Good. Now I'm going to listen to your aorta. I'm listening for bruits. I'm going to listen to your iliac arteries and your renal arteries. I'm going to do that with my bell also. Aorta, iliac arteries, and renal arteries.
General appearance. I want to look at how he's breathing. I want to look at his chest, see if it's equal, that there's no lesions, there's no marks or anything like that. While he's like this, I'm actually going to also assess and make sure that he, can shrug his shoulders and things like that. So push up against my hands. Shrug your shoulders like this. Look at me. There you go. Shrug your shoulders again. Perfect. Good job. I'm going to have you puff up your cheeks like this. No, push them out. Other way. Don't suck them in. There. Good job. Okay. Suck them in. There you go. You don't have to suck them in. Just breathe normally. Okay. And so now I'm looking at him. So while I have him like this, I'm actually going to do like the cardiac assessment. So I'm going to start off listening to his heart. So I'm going to start with the aortic valve. So I'm going to start on this side. Then I'm going to go to the pulmonic valve. Then we're going to go to Herb's point. Then the tricuspid. And then I'm going to go a little bit over because I want the mitral valve also, which is, that's the PMI as well. But I want to listen to the mitral valve. And so now that I've listened with the diaphragm part, I'm going to flip it over with the bell. And I want to make sure that I don't hear any murmurs. So again, starting the same landmark, the aortic valve. And ideally, again, I would do this for about a minute. Pulmonic valve. Herb's point. Tricuspid. And the mitral valve. Okay. So I'm now going to have him lie down. So go ahead and lie. Actually, you know what? Yeah, lie down. And then let me see if I can angle the camera. So here, like this. There. Hang on, let me see if I can put the camera on my pillow, see if that's better, so you can see. Okay. So while he's also down, I'm going to look for any type of like JVD. So I'm gonna actually, if he were in an exam room, I would elevate the head of the bed to about a 45-degree angle. Look that way, like look at the pillows. And I would just look to see if there's any type of distension going on. I will also measure the angle. So I don't see that now. So I'm actually gonna have you look up again. There you go, look at the ceiling. And then while he's like this too, I've already assessed the carotids in terms of palpating for the pulse. I'm actually gonna listen to see if he has any bruits. Good job. Okay. Now while he's sitting up, I'm gonna assess his lungs. So here, I'll have you turn him like that. It's kind of weird as I'm doing it against the camera, but that's okay. So I'm gonna start with the anterior side first. So I'm just gonna take a listen. Just breathe normally. And then so while he's breathing, I'm also making sure that he's not like breathing, that he doesn't have labored breathing. I wanna look at the sides of his chest. Is it symmetrical? Does he have a barrel chest? Does he not? I'm also listening to hear if I hear any type of rubbing or friction or anything abnormal. And he sounds really clear. Go under your arm a little bit. And same on this side. And then I'm going to do the back. So I'm going to have you sit like this so my teacher can see. Kind of like this. Face me. Face me.
Like that?
Yep. There you go. Face me all the way. So typically I would be able to look from behind, but I can still see. So again, I want to see if there's any asymmetry, which he's symmetrical. He doesn't have any labored breathing. I want to also feel, you know, for any lumps, any bumps. I don't feel anything like that. You can also percuss. Forgot to go side to side. So I don't like feel anything like any dull spots or anything like that to indicate that there's water or liquid or fluid anywhere. I shouldn't say water, but fluid. So I'm actually I want to start at the top so that I'm doing everything consistently. So big deep breath. Good. And the same thing, I will listen typically for about a minute. And then I will also take this opportunity to count his respirations. And I forgot to mention too at the front, when I was doing this cardiac assessment, if I were going to do an apical pulse, I would have done it over the mitral valve, just because that was the best place of contact in terms of being able to actually hear it, to get a good apical pulse on him. Okay.
So I'm gonna go ahead just to inspect your lungs. Okay, anterior posterior ratio is 1 to 2. Okay, so now I'm gonna go ahead and ask you if you can stand up for me. Okay, I'm gonna for expansion. So can you take a deep breath? Okay, I'm just gonna lift this up for you. Okay. So can you do it for me, please? Okay. And for the front as well. Okay. Chest expansion is symmetrical. No tenderness or palpitations. So now I'm gonna go ahead and can you sit down for me, please? Or face me. Okay, so now I'm gonna go ahead and check for the 18 side. So, okay. Can you come to this side, please? Right here. Can you face? Alright. Okay, so when I move my stethoscope, you go ahead and you breathe in and you breathe out through your mouth, okay? Okay, so 1, 2, 3, 4, 5, 6, 7, 8, and 9, and 9. Okay, so I'm going to go ahead and check your anterior. Can you face me, please? Go ahead and breathe in. Okay. I'm going to lift your shirt up, okay? Okay. So, vesicular breath sounds clear. Over lung field, equally bilateral. No adventitious sounds present. It's okay. So now, I'm gonna move over to the heart, okay? So I'm just gonna go ahead and inspect the brachicardium. Okay, I'm just gonna look at your chest. Okay, so no abnormal pulsations noted. Okay, hold on. So I'm gonna go ahead and check the. Okay, so now I'm gonna go ahead and check your valve. Okay, so I'm gonna be checking on your aortic, pulmonic, and earth point. So I'm gonna go ahead and lift your shirt up a little, or yeah, just like that. Go ahead and lift it up. Okay. Aortic, pulmonic, Erb's point, tricuspid, and the mitral valve. Okay, so no heaves or thrills noted. Okay, so now I'm gonna go ahead and find the PMI. Okay, so the PMI. Okay, so the PMI is in the mitral valve in the mid-clavicular line. Okay, so the aortic is located in the right second intercostal. The pulmonic is on the left side and is in the second intercostal. Pulmonic. Erbs is in the third intercostal. The tricuspid is on the 4th to 5th intercostal on the left side as well, and the mitral valve is in the 5th intercostal on the left side, and no thrill or heaves noted for any valve. Okay, so PMI you already heard. Okay. Okay, so now I'm gonna listen to your S1, S2, and S3 and S4. Okay, with the diaphragm first. Okay. 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 So S1, S2 heard and not diminished. So no S3 or S4 systolic with diaphragm.
So back to what I'm saying. So we're going to inspect your chest. We're going to look for any deviations. We're going to look for labored breathing. We're going to use for accessory muscles. I'm going to check for any lesions. Now I'm going to palpate your chest. I'm just going to touch it, and I would like you to tell me if it's sore, okay, or any tenderness. Feel up the breast, please. Any soreness?
No.
Okay. I'm going to listen. I would like you to take a deep breath, and I'm going to go slow. No, not right now. Just when I go to listen, just take a deep breath for me, but I'm not going to rush you. Okay? No, I'm just going to have you flip around and I'm going to listen to your back. Okay, I'm inspecting your back. I'm just looking for any lesions. I'm looking for symmetry. Any bony deformities, I would also check in the front for those as well, and in the back. I'm going to palpate your back. I'm just going to touch, let me know if there's any tenderness. Any tenderness? Anything?
No.
Okay, I'm just going to percuss, which means I'm just listening. Anything abnormal? Okay, I also wanted to say that if I found anything abnormal, then I would also do a test for bronchophony, egophony, and a whisper pectoriloquy testing as well. I'm just going to have you say 99. I'm going to place my hands in your back.
99. 99. 99. 99. 99. 99.
Okay, I'm going to listen. Again, just take deep breaths, but I'll go slow. Okay. I'm going to check for thoracic expansion. So I'd like you just to take a deep breath for me. Okay, great. I'm going to check for CVA tenderness. Just going to put right here. Feel any pain?
No.
Feel any pain?
No.
Okay, great. All right, I'm going to have you turn around. I'm going to listen to your heart and your lungs. I'd like you to lie down. Or your heart and your vessels, sorry. You okay? All right, I'm going to be checking your 5 assessment areas. My goodness, sorry. I'm going to be checking, there's 5 of them. There's your aortic area, which is located your second intercostal space, right sternal border over on this side. Then there's the pulmonic area, which is second intercostal space, left sternal border. Your pulmonic area is the second intercostal space. Your third intercostal space is your Erb's point, which is left sternal border. Your tricuspid area is fourth intercostal space, left sternal border. And then your mitral area is fifth intercostal space, midclavicular line. I'm also going to listen to S1 and S2 sounds. S1 is due to the closure of the tricuspid and mitral valves, and S2 2 is from the aortic and pulmonic valves closing. I'm going to check for systolic and diastolic murmurs. Systolic occurs after S1, diastolic occurs after S2. And I'd also like to say that if I listened and found anything abnormal during this exam, that I would have you either sit up or move to your left lateral side, which brings the heart closer to the chest. So the first thing I'm going to do is I'm going to be inspecting your chest area. I'm looking for any pulsations. I'm looking for any heaves, any lifts, any vibrations. I'm going to palpate your area, again feeling for pulsations and vibrations. I'm just going to... Okay, no pain, no tenderness in any of those areas.
No.
Okay, now I'm going to listen with my stethoscope.
All right, so can you tell me, do you feel like your heart's ever racing?
No.
Have you had any chest pain?
No.
Any cough or sputum production?
No.
Any wheezing or snoring?
No.
Okay, so looking at her chest, her clavicles are even and symmetrical. I'm actually also going to feel for your carotid pulse. Okay. Carotid pulse is 2+ bilaterally. And now I'm going to feel for your lymph nodes. Okay, did you have any pain when I was feeling your neck?
No.
Okay, and I did not feel any masses while palpating her lymph nodes. Okay, so her clavicles are even and symmetrical. Her sternum is in the midline, and her skin is uniform in color and intact. Her transverse to AP ratio is 2:1, and she appears to have ease and configuration while breathing in and out. And there's no use of accessory muscles while she's breathing. So I'm going to listen to Erb's points at the 3rd intercostal space at the left sternal border for 1 minute. Okay, heart rate is 80 beats per minute. So now I'm going to take a listen to your bronchovesicular sounds. And when I put my stethoscope on your chest, take a deep breath for me. Okay? Okay, bronchovesicular sounds were clear and there were no adventitious sounds. And now I'm going to listen to your anterior vesicular sounds. Take a deep breath. Okay, anterior vesicular sounds were clear and there are no adventitious sounds. Can you turn this way for me, please? Okay, so
So now I'm going to listen to her posterior bronchovesicular sounds. Take a deep breath. Okay, posterior bronchovesicular sounds are clear and there are no adventitious sounds. And now I'm going to listen to her posterior vesicular sounds. Take a deep breath. Okay, posterior vesicular sounds were clear with no adventitious.
Thorax and lungs. So, can you look down? Alright, so first I'm gonna observe for any sign of stress breathing, the chest contour and shape of the chest and back, and any sign of color changes. So can you turn them and face it? Right. So the first thing, we're gonna palpate for 10 minutes. I want you to breathe in and out for me. One more time. Alright, good. Now we're gonna tactile friendly. So when you feel my hand, I want you to say blue balloons.
Blue balloons. Blue balloons. Blue balloons.
Alright, good. Now we'll go ahead and percuss areas. Alright. Now I'm gonna auscultate each area. When you feel my stethoscope, I want you to breathe in and out with your mouth open. Turn back around for me. We're gonna do the exact same thing. Alright, so I'm gonna start off, since I continue. Let's do it for me. Alright. Now we'll go breathe in and out for me. One time. Alright, good. Now we're gonna go tactile friendly, so when we feel my hand on, say blue balloons.
Blue balloons.
First thing we're going to do is inspect the color and warmth of both of the extremities.
Blue balloons.
Alright, good. Now we're gonna percuss each area.
Ulcerations or changes in hairs and also color and warmth. Now we're going to do the pulses. So we're going to start with bilateral radial pulses. Okay, and we're going to do ulnar pulses. And we're going to do bilateral vertical pulses. Okay, for the lower extremities,
shirt. Looking for any respiratory distress, any abnormalities in shape or movement. Looking for chest expansion, making sure everything's symmetrical. Gonna listen to his breath sounds on the anterior here. Then I'm gonna have you turn and face your back to the camera here. And listen to the back here. I'm gonna have you say E when I'm listening to each spot.
E, 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 E,
Say 99.
99, 99, 99, 99, 99, 99.
And whisper 1, 2, 3. Okay. Just gonna put my hands here. Take a nice big deep breath for me. Perfect. Now say 99.
99, 99, 99.
Just gonna tap on you here. Okay, nice big deep breath for me. Breath in and hold it. Okay, let it all out and hold it. Okay. Let me know if there's any tenderness, okay? Tenderness?
No.
Okay. I'm gonna have you lay down right here. We're pretending that this head of the bed is 30 degrees. Okay, and look that way. We're gonna look for jugular vein distension. Listen to your carotids here. And head the other way. Okay. Gonna check your cap refill. Looking for any edema. And taking your socks off. Gonna listen to your heart sounds. Hopefully you can see this. Whoops, hit you with my stethoscope. See this on camera. And again, I'm inspecting his abdomen and his chest, looking for any asymmetry, any pulsation. Okay. 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 Good. Now, can you go ahead and turn that way for me a little bit? Okay. I'm gonna listen to your back. Okay. Okay. Can you take a big breath for me? Good. Okay. And the other side? Okay. And I'm going to be putting my hands on your back, and every time I put my hands down, I want you to say 99. Okay?
99, 99, 99,
Say a little bit louder.
99.
Okay, good. Now I'm going to be tapping on your back, okay? You let me know if any of it bothers you. Good. Okay. Okay. Next, I'm going to take a big listen, okay? Each time, you know what? Can you turn a little bit this way? Okay. Each time I put the stethoscope on you, I want... Stethoscope's falling apart. I want you to take a big breath, okay? And let it out for me. Okay? Big breath. Good. Another one. Good. Good. Okay. Great. Okay. And one more thing back here. Does that hurt? Okay, great. Go ahead and turn back around this way. Okay. All right. Put your legs down for me, okay? Arms on your side. Just breathe normal for me, okay? Okay. Okay, I'm going to take another listen, okay? Same kind of breaths, okay? Big breath out. Good. Big breath out. Great. Okay. Okay. Just breathe normal, okay? Okay. I'm going to listen to your neck. I want you to go ahead and take a normal breath and hold it for me. Good. Okay. And again. Good. And again. Good. And one more time. Good. You okay? Okay.
To the posterior thorax Can you please get up and turn around? So for the posterior thorax, I will inspect and I see that hair distribution is even. There's no scarring, the color is appropriate. There's no lumps, bumps, lesions, or bruises. I'm going to palpate. Do you feel any pain or tenderness?
No.
Okay, texture is smooth. Turgor is good, non-tempting. Temperature is warm. So that's good. And now I am going to check for symmetrical expansion, chest expansion. I'm going to put my hands here, and can you please take a deep breath in and out? So symmetrical chest expansion is good. I'm now going to auscultate and listen for her breathing sounds. Every time I move my stethoscope, can you please take a deep breath in and out?
Yeah.
Okay. Okay, so from what I heard, her breathing sounds were normal. I didn't hear any crackles or wheezing or any adventition sounds. Everything was clear, and now I'm going to inspect and palpate the anterior thorax. So the anterior thorax is, there are no lumps, bumps, lesions, or bruises. I don't see any lacerations, nothing like that. I'm going to palpate the anterior chest. So do you feel any pain or tenderness as I do this?
No.
Okay, texture is smooth, turgor is good, non-tempting, moisture is normal. Okay, and then now I'm going to listen, auscultate the anterior chest. So as I move my stethoscope, can you take a deep breath in and out, please? So her breathing sounds were normal. I didn't hear any crackles or wheezing. Her rate and rhythm was regular. And everything was good on that part. And now I'm going to listen to her heart sounds. I will locate all the valves. So her aortic valve is located at the right sternal border, second intercostal space. Her pulmonic valve is located at the left sternal border, second intercostal space, and this is where S2 is louder at the base. Her Erb's point is located at the left sternal border, third intercostal space, and that is where S1 and S2 are heard equally. Her tricuspid valve is located at the left sternal border, fifth intercostal space, and that is where, that's the tricuspid valve. And the mitral valve is located at the midclavicular line, fifth intercostal space, and that is where you can hear the apical pulse, as well as it's located at the midclavicular line and fifth intercostal space, and you can hear S1 louder at the apex. So I heard her heart sounds, the rate and the rhythm were regular, they were equal, the pulse was equal, and I did not hear any abnormal sounds.
We'll take a listen to your heart. We'll take a deep breath.
Go ahead and say 99 for me.
99, 99, 99.
Okay, you can sit up. I'm gonna do the same thing for your back. Okay. Deep breath. Good. Okay. Can you say 99 for me?
99, 99, 99, 99.
Okay. I'll go ahead and feel your back. Let me know if you feel any pain, okay?
Okay.
Any pain?
No.
Any pain?
Next. So first we will begin palpation. Do you feel any tenderness? Okay, I will check her carotid. And they are aligned accordingly. They are +2 pulses as well in rhythm and very strong and healthy. So at this point, I would begin the assessment. I would also pinch the skin to make sure that it reacts accordingly. I will begin the assessment for your breath sounds. Is that okay? So, can you breathe in for me? And can you breathe out? She did a great job. There were no arrhythmias, mumps sounds. Her breathing rhythm was very smooth, and there were no distinctive sounds that would pique my interest as anything to be worried about. So moving on, I would assess her heart rate. So I would first begin with the second intercostal space. I would then move down to the fourth intercostal space for the tricuspid. I would then move down to the fifth intercostal space for her mitral valve. Making sure that it hits mid-clavicular line. There it is. At this point, I could also test her apical pulse, so we'll just go ahead and do that and just make sure that I'm in the correct place. I will start. Mid-clavicular line. Okay. She has a +2 pulse. I didn't hear any arrhythmias. Sounded perfect and healthy and bouncy. So at this point, we would then continue on to assess her back for any situations. Due to camera restrictions, I'm going to have the patient just move slightly for a better angle camera view so that you can view the procedure accordingly. So I would, at this point, ask her to breathe in.
and breathe out. And I would assess her breathing again. You did an excellent job. I should have palpated in the beginning to make sure that there were no lumps or masses or tenderness. Do you feel any pain? Okay. So at this point, we will
listen to Connor's heart sounds at this time. And we'll do that in a Z pattern, and what we're listening for are all of the valvular areas, and those are in the intercostal spaces. So we're going to listen for those. Good strong heart sounds. You can also use the bell of our stethoscope to listen to the neck vessels this time. Listening for bruits, anything unusual. So while we're in this position, we'll go ahead and auscultate breath sounds. Just makes sense to do it now. So we'll use the diaphragm part of our stethoscope. Have Connor turn around. Now we want to listen to full lung fields, and the lungs expand above the clavicular area. The apex of the lungs do. So good deep breath. Good. Now we're listening in a Z pattern. We're comparing left side to right side. We're listening for normal versus abnormal. Good. Good. Turn around. Everything sounds clear. I don't hear any wheezes or bronchi. Good deep breath. We want good, strong airflow. That's what we're listening for. Good. Okay, so now I'm going to listen to Connor's apical pulse. There were no abnormal heart sounds noted, no splits, lifts, rubs, nothing of that nature. Everything sounded very normal for Connor. So we're going to listen to the apical pulse on the left side. The apex of the heart should be good and strong. It's got a heart that can fill up a swimming pool. And we'll count that for, some people do it for 15, times that by 4, some do it for 20, times that by 3. Depends on what you hear, I guess. Good strong apical